one of the reasons why you need to discuss family planning is the health and age factors.
Yes.
You know that a woman has, or both sides have biological clocks, but a woman's own expires very quickly. So
Okay.
he said that when the biological clock is ticking, it's always better to do things at the right time. For instance, it is said that the peak period for a woman to have birth, where she will be in full health and will likely give birth to very healthy babies, is when she's between the ages of 17, 18 down to 30 something.
Okay.
So, you know, when they are planning the family, when you delay unnecessarily, sometimes it can cause problems. And then again, for a woman to keep on having children even after she's nearing menopause may not also be very good for her health.
For our health.
So
Okay.
that's where the health and age considerations will come about. That the couple should try as much as possible to marry at the right time, and when they marry at the right time, to also plan their children having in the way that, you know, their health matters. Even for men, you know, as you get older, there are some functions of your body that will not be as optimal as it was before. So when you are still in good health, to take care of these children and they grow up to meet you still strong,
Yes.
it's actually very much better. And we have a lot of fertility issues nowadays. In fact, it's a very sad commentary, you know, because always you are hearing about people who have been trying to have children. They spend millions on IVF and other birth procedures, you know, and they keep on trying and trying. So because of those issues, you know, health and age factor will also matter a lot. And I've had situations where one party is concerned, while the other party doesn't really concern. The hair is not really bothered. So this is where it is important to have this discussion, so that, you know, one person should not be craving to have children while the other person is not concerned at all.
Yes.
There will be a rift in the marriage. It's even used to divorce sometimes.
Yes.
You see a woman who say that, okay, we've had health issues, challenges, and then I'm the only one that keeps going to the hospital. I'm going for tests, I'm going for different kind of procedures, I'm spending so much money, and my spouse is not concerned at all.
Not concerned about
because he has other children, or maybe he just,
or
it's also possible that he may have the problem. What we have generally, what I see generally in not just in Nigeria, generally, is the fact that the first point of call when there's a problem, when there's fertility issues, that is for the woman to be blamed.
Yes.
And doctors are now saying that in many cases, these fertility issues may be coming from the man too. So it's only when the man submits himself for health checkups and medical procedures that these issues now unravel, and then they now start to seek treatment.
Yes.
Because, you know, because of this century is coming with a lot of, I don't know, maybe the things we are eating, but there are a lot of health challenges now. You're having different kind of cancers that we didn't used to hear before, and all kinds of things. And because of the way our bodies are now, you know, infertility is now affecting both men and women. I've seen a girl in her 20s that is having fertility issues. We have had men who ordinarily look very healthy and virile, but are actually said to be sterile or having low sperm count and this and that. So all these things, we need to be honest about it. Yeah. In marriage, honesty is very, very important, that both parties open up to each other to make themselves available for medical checkups and all this kind of things, so that we don't keep on having. And another thing is where they both don't agree on what family planning methods to use. You know, it may be that, okay, one party is saying, I don't like the orthodox family plan, the conventional family planning methods, or maybe the one is being affected by injections and all that, and you are trying the natural family planning method and it's not working. So, you know, all these things, they need to come to an agreement about these things. Or where a woman is using contraceptives and the husband does not know about sex. Talk about that. Trying to have a child and he doesn't know that his wife is on pills. He's on contraceptives. So all these things create a rift in marriage that at the end of the day, it may cause serious conflict between the family.